This week on Healthy Living, a look at the health and wellness of old people. Ivorian Gerontologist Dr. Antoine Droh shares some tips for healthy aging. And a senior in Nigeria shares his healthy living secrets as he nears 100 years. We'll have these stories and more in this edition of Healthy Living. Hello and welcome to another episode of Healthy Living. I'm Linor Moudou. People around the world are living longer. According to the World Health Organization, the number of people aged 60 and older is expected to double by 2050 to more than 2 billion. The majority will live in low and middle income countries. Experts say as people age, they may face common health conditions such as cataracts, hearing loss, diabetes, and back and neck pain. Older age is also associated with the appearance of various complex health conditions known as geriatric syndromes, including urine incontinence, dementia, and falls. Observers say in Africa, some older adults often face unique wellness challenges that are influenced by a combination of socioeconomic, cultural, and healthcare factors. Among other things, changing family structures and urbanization can lead to increased social isolation for some older individuals, impacting their mental and emotional well-being. Malnutrition is a pressing concern, often exacerbated by poverty and food insecurity. And access to quality medical services can be limited, especially in rural areas. In the African society, an old person is regarded as a powerful figure who keeps the culture alive and serves as a guide to the younger generation. However, old age comes with a myriad of challenges, including health problems and access to adequate health care. Juma Majenga reports from Kibera slum in Kenya.
In Nairobi's informal settlement of Kibera, we meet Anne Musanga, a 70-year-old widow. Musanga says all her relatives died and now she has no one to depend on. She has a difficult time getting medicines whenever she goes for treatment.
When you visit a hospital like this one, you get examined, but you're told there are no medicines. Sometimes we get assisted to go to hospital by well-wishers. We go, but we don't get medicines. That is the challenge we have. So we're asking ourselves, is it that we, the elderly, are not supposed to get treatment, or indeed there are no medicines?
65-year-old Daniel Ngogi is also a resident of Kibera. He shares the same sentiments.
Kama ni upande wa matibabu, tuna shida.
We have a problem on health. Sometimes if I go see a doctor and tell them my body is aching, you hear them whispering to each other that my problem is just old age. Then they give me paracetamol. How can paracetamol help me? They just ask, how old are you? And when you say 65, 70, you see them withdrawing. They see you as an old age problem. The respect that an elder used to be accorded is no longer there.
Life expectancy is increasing globally. However, the increase in the number of elderly persons in developing countries has not had a corresponding increase in social and healthcare support systems for the elderly. Domitila Ogaro is the coordinator, clinical health services at the Kibera sub-county.
As we age, many diseases come, and so as we are dealing, we always interact with the elderly, and when they come to our facilities, majority of them mostly present with the non-communicable diseases. When I talk of non-communicable diseases, we have hypertension, which is the commonest. We have diabetes, we have mental health issues, we have cancer issues, we have, then now we have the communicable diseases as well that also affects the old.
Accommodate as many older persons.
To help the elderly in Kibera access healthcare and other essential services, Agnes Karaoke founded Kibera Daycare Center for the Elderly. Since its inception over 3 decades ago, The center has helped over 6,000 elders, including 1,200 who are currently enrolled at the center.
The first thing they have gotten is a shoulder to cry on. They come and interact with their peers. When one stays alone, all they think of is their problems. But when they come here, they share their issues and get motivated. They may have problems, but when they come here and share, they get solutions.
Elderly people like Anne Musanga and Daniel Ngugi hope to see infrastructure and measures in place that will mitigate the challenges of aging. Juma Mujanga, VOA, Kibera, Kenya.
Although aging comes with its set of health challenges, it is possible to maintain good health while aging. We spoke with Dr. Antoine Droh, a gerontologist in Abidjan, Côte d'Ivoire, and asked him how.
When we talk about aging, there are the social and physical aspects, but above all, the mental and psychological aspects of the elderly person. Because when this psychological dimension is poorly handled, it has an impact on the other aspects, both social and physical. When an elderly person doesn't feel good, but is pressured to say so, society's view of them will have an impact on their morale and mental state, leading them to isolate themselves. Isolation leads to frailty, and frailty leads to dependency. The person needs a dynamic family with active children. Secondly, they must still feel loved and cared for by their family. Aging begins at fertilization and continues from birth. It's a process that necessarily leads to old age. Retirement is not the end, and neither is old age, but a new beginning of life. And at that age, you can do a lot of things. You can go into volunteer work for a humanitarian organization. That's important because it also contributes to personal fulfillment. It also contributes to healthy aging because it prevents isolation. As soon as you retire, you look to join a social group or to get involved, to convert and do something else. Not necessarily for money. Volunteering is important. Physical activity is extremely important for the elderly because physical activity not only contributes to healthy aging, but also helps maintain health and prevent certain pathologies and diseases, such as diabetes and hypertension. You don't have to wait until you are ill to be able to observe the hygienic dietary rules that have been imposed by illness. Because now, it's no longer instinct that tells you to do it, but illness that imposes it, telling you to do this, do that. But when you do your own preventive gerontology, when you do your own physical activities, this contributes greatly to successful aging.
In Nigeria, there are rising concerns that poverty among seniors could worsen in a few years if issues around low pension coverage is not addressed. Data from Nigeria's Pension Commission show that only a small fraction of workers in the West African country are subscribed to benefit from pension schemes. Gibson Emeka has this story from Abuja, Nigeria.
53-year-old Elias Ohaneje works as a logistics manager for a private electronic firm in Abuja, Nigeria's capital. Despite working for over a decade at the firm, Ohaneje has not subscribed to any pension investment scheme. He says his employer had not properly educated him on the need or importance of a pension scheme.
It's just work and go. Work, they pay and you go. There's nothing like pension. There's nothing, we're not going to say about pension with the company.
Ohaneje is not alone. In Nigeria, the risks of poverty worsen with age due to insufficient social protection systems and retirement investment education, according to the United Nations Department of Economic and Social Affairs.
It leaves them unfulfilled, it leaves them in despair, it leaves them, in some form of psychological chaos, and that is the psychological implication. So the stress level becomes high because poverty is a trigger for stress.
According to Nigeria's Pension Commission, as of the second quarter of 2022, only about 15 to 17% of the nation's workers had an active pension account.
There is delay in the payment of pensions, especially at the subnational levels. Some agencies of government or some employers of labor have not deliberately captured the pension of their staff. And some even who have deducted have not remitted.
Orakpa says to help solve the problem, the government should invest in early pension awareness programs for workers and to encourage worker buy-in by monitoring and removing pension payout bottlenecks.
Now, the fountain of youth may not exist, but some old people are living a long life in relatively good health. Tanko Yakasai is a resident of Abuja, Nigeria, who is almost 100 years old. He shares his story of health and wellness.
So together I'm known as Saliu Abubakar Tanko Yakasai. I was born in Kano in 1925. I brought up in Kano, although from time to time I travel out, but I spend most of my life in Kano. I've been fortunate to have a good health. I don't have anything specific to mention as being responsible for my good health, except that I would say I got it from my parents. My parents, both my father and mother, lived together. To the best of my knowledge, they had no permanent ailment. My father died at 105 years of age. My mother at, I think, 90-something, can't remember precisely, years old. But I'm privileged to produce 23 children. 4 died, 19 are still alive, with more than 63 grandchildren. I eat normal food. The Hausa people eat tuwo and other things like that. But I don't have any speciality. I take whatever is available to me to survive. And I'm not greedy. I don't have any special diet for myself. I ate what I get. There's no special thing that I am forbidding from eating. I eat everything I like.
Falls are the leading cause of fatal and non-fatal injuries among older adults. That's according to the U.S. National Council on Aging. However, falls are not a normal part of aging and they are preventable. Here are some suggestions by the Council that older adults and their family can take to reduce their risk. Keep your home safe. Remove tripping hazards, increasing lighting, make stairs safe, and install grab bars in key areas. Find a good balance and exercise program to build your body's balance, strength, and flexibility. Get your vision and hearing checked annually. Your eyes and ears are key to keeping you on your feet. Review your medications with a health professional to make sure any side effects are not increasing your risk of falling. Thanks for watching Healthy Living. For the latest news and coverage, stay connected to Voice of America at voaafrica.com. You can follow me on X, formerly known as Twitter, at Linormudu. That's our show for today. Until next time, stay well and strive to make every day a healthy day.